Hi, I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon practicing in Aestiva Clinic, Saket. Today I'm going to be talking about fat grafting, a procedure which is gaining increasing popularity in the recent times. Fat grafting as a procedure has been present for a long time. It has been used to correct scars and also to correct minor breast asymmetries. However, in the recent past, the application of fat grafting has greatly expanded and is used to correct volume loss in the face. It is used to correct breast asymmetries and also give a minor amount of augmentation. It is used in the hands to give a plump, young look and also to rejuvenate the overlying skin, minimizing wrinkles. Also, a very important part of fat grafting is the Brazilian butt lift, which involves taking fat from other parts of the body like the abdomen, the back and the inner thighs and injecting it into the butt. A procedure which improves the contour of the body overall by providing a narrower waist and also increases the projection of the butt. So overall the physique of the patient is improved. So what does fat grafting involve? Fat grafting involves harvesting fat as is done in most of our liposuction surgeries and then purifying it using either decantation simply or by other techniques like centrifugation. Purifying the fat and then injecting it using minute cannulas into various parts of the body. So for example, if I want a rejuvenation of the face by addition of volume, then I would use very fine cannulas starting from around 0.7 mm to 2 mm and inject it through strategic points on the face. So by this, I achieve volume augmentation in the form of fuller cheeks, a decrease in the nasolabial folds, a decrease in the baronet lines, and also in some cases, the temporal hollowing can be addressed by fat grafting. So this is basically fat grafting in small volume. So the entire face is covered, say by about 20 cc of fat to 50 cc of fat, depending upon the patient's requirements. So larger volumes of fat grafting are required in areas like the breast, where the aim is to increase the volume, or it can be simply to correct asymmetry. So in the breast, probably we would require about an augmentation of 200 to 250 cc per side in one sitting. Similarly, if we come to the butt, then the volume augmentation, depending upon the frame of the patient, can be about 600 cc to 800 cc per side in a single sitting. Now, fat grafting can be done under local anesthesia if it's to be performed for smaller areas like the face or the hands. But if you're going to perform a fat grafting for the breast or the Brazilian butt lift as we have discussed, then this requires some form of general anesthesia. It is essentially a day care procedure and takes about say half an hour if it's done for the face, to about 3 to 4 hours if it involves liposuction of multiple areas, purification and then injection into big areas like the breast or the butt. It is a daycare procedure and the patient is discharged within a couple of hours. The dressings are there for about 1 day and can be removed after 24 hours and substituted in certain areas like the breast or the butt by compression garments which will provide support to the newly injected fat. In some selective scenarios, like if the person wants a minimal augmentation of the breast and is not desirous of going in for implants, then fat grafting is a good option. Similarly, for a butt lift, it is more safe compared to butt implants which were extensively used earlier but have been found to be associated with complications. Another advantage of fat grafting over implants is that you're using the body's own tissue, so the chances of rejection or infection are very less, practically nil in fact. Also, since we are going to be doing a liposuction of the other areas to harvest fat from, the overall proportions and the overall contour of the body improves. It's also used in the face as a substitute to say dermal fillers. So for people who do not want to undergo dermal fillers again and again, fat grafting in maybe 2 or 3 sessions can provide lasting results. So the downside to fat grafting is that the fat tends to get resorbed. Even in the best of hands, only about 50% of the fat is going to stay per sitting. So it is necessary that we do about 2 to 3 sittings of fat grafting depending upon the area. But having said so, whatever results are achieved at the end of these 3 settings are pretty long lasting and are going to last out for almost 7 to 8 years, provided the patient follows a healthy lifestyle. Whereas whatever filler is being used is not going to last for more than a couple of years at the maximum. Also, fat has certain other advantages which fillers lack. So fat has stem cells which provides a rejuvenation of the overlying skin, which is very beneficial in areas like the face. So once you've injected fat, the stem cells present in the fat, just like in a PRP, are going to decrease the appearance of fine lines and wrinkles over a period of time. These results, however, are not instantaneous and take time to show. So you'll see these results within about, say, a couple of months' time from the time you first start the procedure. Again, another advantage of fat grafting is that the post-operative care is very minimal. There are practically no cuts and no stitches anywhere in the body. So wherein if you inject fat into the breast, you're going to be having just about 2 tiny holes which are 3 mm, 4 mm each, from which the fat has been injected, compared to an implant which will have an incision of at least 3 to 3.5 centimeters. So provided that we have chosen a good candidate who does not have sagging, who is not wanting a very sudden augmentation or a large augmentation, fat grafting is a very good alternative in such patients. Also, in terms of the cost effectiveness, if we think about fat grafting, yes, initially it does involve 3 sittings and might work out to be a little more expensive than the filler, but because it is much longer lasting, so the benefits outweigh the small initial investment, which is a little higher than fillers. Very fine fat, also called nanofat, which is created by processing the harvested fat using specialized devices, and this nanofat is going to be injected into the scar tissue. Here we're taking use of the rejuvenative properties of the stem cells in fat, which help improve the overlying skin in the scar. Also, it can help lighten the scar and probably make it merge better with the surrounding skin. However, nanofat again is not done in a single sitting, and to achieve good results, we have to give at least 4 to 5 sittings of nanofat injections into scars. So overall, fat is being used almost everywhere. It's being used to plump the body, it's being used to correct depressions, it's being used in scar tissue, and is a very effective and a very, very safe procedure. The only thing is you should be prepared for 2 to 3 sessions of fat grafting depending upon the area which is being treated. Also, the surgeon performing this procedure should be well qualified and should be taking proper precautions, observing a proper aseptic technique so that the fat does not get infected and also does not form any lumps or irregularities which can happen with the use of excessive fat in one go or improper instrumentation. If these factors are considered while performing a procedure, the satisfaction rate is very high in fat grafting and gives the patient long-lasting and natural-looking results. I hope this video has answered most of your queries regarding fat grafting. If you have any further questions, please feel free to connect with us at the details provided below. Also, if you found this video useful, please press the like button, share and subscribe to our YouTube channel for further updates. Thank you.